dark. If we do not act now, antibiotic resistance, and more broadly AMR, could claim millions of lives each year and cause a global economic downturn comparable to the Great Recession. But AMR is not just a distant abstract threat. It is current, personal reality for communities across the world. We know that AMR disproportionately impacts vulnerable populations, those with limited access to healthcare, those in lower and middle income countries, and lives in the midst of humanitarian crises. And yet, while this problem is global, the solution must also be local and community driven, because it is the people on the ground, the patients, the families, the healthcare workers who bear the burden of this crisis. Today's event is about amplifying those voices, the voices of communities and civil society, which have often been sidelined in the global health discussions. As we approach the UN General Assembly high-level meeting on AMR, we are here to emphasize the critical role that communities and civil society organizations play in containing AMR. We are here to declare loudly and clearly that a whole of society response is not just desirable, it is essential. Communities and civil societies must be at the center of the global response. Communities are excellent advocates and great innovative solution finders. Communities, together with civil society organizations, are the ones who can hold governments accountable, who drive behavior change, and who ensure the strategies are rooted in real-world needs and experiences. Today's event is a pivotal moment in the lead-up to the UN General Assembly. It represents an opportunity to bring the realities of AMR closer to decision makers, to make our voices heard, and to ensure that the needs, experiences, and wisdom of communities are fully integrated into global policies and actions. We have gathered here to present a unified call for global action, a powerful document crafted by communities and civil societies from all over the world. It contains key asks directed at global leaders, urging them to make concrete, time-bound commitments to address AMR. Since its launch in April 2024, this call has already gathered huge momentum, reflecting the strength and solidarity of our global community. So, what we can expect today? We'll start with heartfelt testimonies from communities and representative and patient survivors. These voices will remind us of the human impact of AMR, the stories that the numbers cannot fully capture. We will then move into dynamic go-around discussion where we'll hear from civil society organizations working tirelessly across different regions. They will share concrete examples of grassroots effort and community-led solutions to contain AMR, offering us a chance to learn from each other and strengthen our collaborative efforts. Later, we will present our call for global action, highlighting its origin in the Power Communities Initiative, as well as the urgent and necessary steps that must be taken at the high-level meeting and beyond. We will then have the honor of officially handing over this call to representative leaders and member states, a symbolic yet significant act that demonstrates the importance of this document and the urgent need for political commitment at the highest level. Finally, we will conclude our formal program with video testimonies from around the world, reminding us all that this is a global issue requiring a global response. And of course, we will continue our conversation informally afterward with a mingled food, drinks, music, and a powerful exhibition. But before we dive into this rich discussion, I want to take a moment to call each of us to reflect on the significance of our gathering today. We're not here just to talk. We're here to act. This event must be a turning point, a catalyst for renewed urgency and collective commitment. The stakes are too high for business as usual. As we listen to testimonies, engage in discussions, and share our experiences, let us also think about the steps we can take, both individually and collectively, to accelerate action on AMR. Let us use this platform to galvanize the political will needed to turn the tide in this global crisis. I want to finally take this opportunity to thank everyone who has contributed to making this event possible, to our community representatives and patient advocates who have traveled from near and far to share the stories. thank you for your courage and commitment. To our panelists and speakers, thank you for your insights and your dedication to this cause. To our partners and sponsors, we're deeply grateful for your support. In closing, I invite you all to listen, engage, and be inspired. Let us work together to ensure the voices of communities are not only heard, but acted upon. Let this event be the spark that ignites a powerful and sustained response to antimicrobial resistance. Thank you all for being here today, and thank you for your commitment to this critical cause. Let us move forward together, from people to leaders, and make a lasting difference in the global response to AMR. Thank you. So now we're moving to the next session, where we're going to hear stories and testimonies from community representatives and patient survivors. So the first one we're going to listen to is Ms. Rabia Kaish. She's a public health expert with over 10 years of experience in TB, HIV, and gender-responsive health programming, currently leading monitoring and evaluation in TB at the and development for people living positively with HIV and AIDS. She serves on the board of the Tanzania Stop TB Partnership, Tanzania TB Community Network, and the Afro Smart for TB Community Advisory Board. Rabia, the stage is yours.
Distinguished and civil societies, co-organizers of this, ladies and gentlemen, and the protocol is observed. On behalf of the communities and the civil societies, we stand at a pivot moment in a moment when a threat of antimicrobial resistance has become one of the greatest challenges to humanity. Each year, more than 1.2 million lives are lost to antimicrobial resistance, and this number is set to rise dramatically if we fail to act now. Infectious diseases like tuberculosis, HIV, and malaria are on the front lines of this crisis, affecting millions globally, especially within the marginalized communities. This is a crisis to ignore. As a proud member of the From People to Leaders Act on AMR NOW campaign, more than 20 signatories, 25 countries, including over 100 and I am here today to represent the collective call to action on our communities, the responsibilities to translate words into action. For communities like those we serve at Chidefa Plus in Tanzania, including the artisanal small-scale miners, the fisher folks, the sex workers, people who use drugs, the vulnerable adolescent boys and girls, people living with HIV, and those who have been affected by tuberculosis. The fight against AMR is not just a policy discussion. It is a matter of life and death. These populations are too often left without proper access to health services, let alone the critical counseling they need on medication adherence and the dangers of the antimicrobial resistance. Tuberculosis is the leading infectious killer in Tanzania, and the rise of the drug-resistant TB only compounds this public health threat. Communities facing tuberculosis and HIV are vulnerable, and the lack of comprehensive health care, education, and proper medication use worsens the problem. We cannot afford to allow AMR to erode the progress we have made in the fight in these diseases. Civil societies and communities play a critical role in bridging the gap between policy and practices. Our work in Tanzania has shown that community-led initiatives can make a difference. For example, SHIDEFA has been addressing TB and HIV syndemic by educating communities on the importance of adhering to treatment regimen and integrating screening into broader healthcare services, ensuring that even the hardest to reach populations receive the care they need. But we cannot do this alone. We need governments, international organizations, development partners, healthcare systems to step up and fulfill the commitments made during the 2016 United High-Level Meeting on Antimicrobial Resistance. We need the policies that put communities at the heart of health responses by increasing investment in public awareness campaign, ensuring that everyone understands the gravity of AMR and how their everyday decisions like taking antibiotics without a prescription can impact the future of global health. We need to ensure equitable access to affordable diagnostic and alternatives so that people do not rely on antibiotics when they are not necessary. We need stronger systems to improve infection control, ensure medications are used appropriately to reduce unnecessary prescription and thus protect both human and animal health. We need a coordinated and multi-sectoral actions at both country and global level. And last, we need leaders who are willing to champion the issues on antimicrobial resistance. One key message I want to emphasize today is that AMR is not just a future threat, but it is a global strategy. And local solutions must be supported on the international level. And it's time now to prioritize the community-driven and the people-centered approaches. Community travel treatment groups, lost to follow-up interventions, has worked in Tanzania in ensuring that people do stay, do retain on treatment. And in sustaining this, we can replicate the efforts globally, but we need the political will and the resources to do so. As I conclude, communities and the civil society movement is not just calling for action. We are part of the solution. We are here to transform awareness into action. The time is now to act on AMR before it becomes even a greater crisis. Let us ensure that our efforts today lay the foundation for a future where AMR no longer claims or threatens the health of our communities. Yes, we can and will stop the AMR. Thank you so much.
Thank you so much, Rabia. That was excellent and very, very inspiring. We were supposed to have John Kariuki from the WHO AMR survivor, but he's stuck in traffic, so he won't make it. But we have more time than for questions. So I'll start with a question, and then I'll also ask the audience if they have any question. So you've been describing, Rabia, some of the key challenges that you've been having also working with the communities, but also some of the hopes that perhaps you have towards the high-level meeting. I wanted specifically to ask you, what is your major hope? What do you think can be achieved during the high-level meeting, and what would be
Yeah, so thank you so much, Andrea, for the question. You know, communities have been facing a lot of challenges. And without the communities, I think nothing, can be done, because that's where now the peoples are, majority of the peoples are there. So going forward with this United High-Level Meeting, my hope is to ensure that the communities, are really empowered. There should be strategies, systems, to which communities can be given opportunities. Opportunities, let it be like training, resources, educative materials, so that they can be in position, to reach the communities which has been affected by the MOR. And they should be coordinated. But if this is not being seen, into the declaration, it's just, there and then you talk and just you leave, then I think the efforts which we are claiming for, it won't yield any results. Yeah.
Thank you so much. Hope you can hear me. Any questions from the audience? Yes, we have one question. Therese? Just please introduce yourself.
It works. Thank you, Rabia, for your good presentation. My name is Karama from Kenya. I come from some community maybe that has similarity with your experience. What is the role of faith healing as a healthcare behavior in relation to microbial resistance and the enforcement of prescription-driven drugs in the pharmacy? I'm told antibiotics by the color of the capsules. Thank you.
Yeah, so thank you so much. We all understand that most of the communities, the first point of care where whenever they feel like, they feel a headache, maybe stomach aching, the first run-up point is the pharmacies. We call them the ADO, accredited, drug dispensing. And we have seen this work, for example, like in our TB work and the HIV, we have been engaging these pharmacies where we train them, we provide the tools, and we link them with the community health workers and the peer educators, so that whenever the patients or the clients visit the pharmacies, they can ask them, okay, what do you feel? Why do you need this medication? So that has been the great role which they have been, providing. And we think now, time is now to engage the pharmacists and the adults in ensuring that they are also aware in providing the education to the communities whenever they visit. And of course, prescription of the color, that has been a practice in Tanzania, as you have said.
Any more questions? No questions? Then we can. Yes, one question. With the mic, otherwise they can hear you from home. Therese, can you?
Okay, yeah, so they go, but what we have done, and we have seen it to be successful, it's engaging the religious leaders, religious leaders from the mosque and the churches, so that after they have the mass, then they can provide some awareness. So people go, but after going, so if this religious leader is being like oriented or being informed about, let's say, MOR, then he can easily maybe have like 10 minutes or 15 minutes, to provide, something related to that. And that we have seen that work in our TB, but also in HIV and malaria work, we have engaged them. So we also feel like for the MOR, if this can be done, it will also be a good opportunity because a great number of communities go to churches, and they listen to the, to these religious leaders,
Thanks. There was another question here. Therese, there is a question here. Tracy?
Curip, you can hear me? I hope. Okay. So thanks, Rabia. Tanzania is one of those countries that we are actually. Tracy Moraya, React Africa, based in Kenya, Nairobi. So Tanzania is one of those countries that we are actually, as other African countries, thinking perhaps we need to emulate Tanzania when it comes to AMR, because it's one of the few countries in Africa that we now see have been able to actually bring to the forefront, to the high level places, and actually put the AMR coordinating body, the national one, at the not prime minister, but the minister of health. Exactly. So they're at high level, and even the campaigns that you're doing are being also championed by the minister herself. So I'm wondering, how well is the coordination going? How well are community representatives such as yourselves translate that to the ground? Because we appreciate that many people say, okay, that's done by the minister, we have no idea what's going on. But how well are you able to do that, and what can you tell the rest of us in communities to this way and get right to the ground for that awareness, whether it's religious leaders or through?
Yeah, well, thank you so much for the question. Yeah, so to describe that, you know, we have got our focal person, who is the antimicrobial resistance focal person, who have been collaborating with the civil society organizations and the implementing partners, you know. So whenever there are meetings, maybe scheduled on quarterly basis, experience sharing meeting, review meeting, technical review meeting. So we go there, we are informed on what changes have been made, maybe systems of reporting and whatever. And then from there, because they are representative from the CSO, I'm here, but also I have a colleague here called Eric. He is also part of the team. So whatever we receive, we also deliver it, we cascade it, you know, to the communities. Maybe together with the community health workers whom we are working with, inform them on what is happening, and those, because they are the ones who direct the communities, they also deliver the messages. So it's a channel, you know, and cascading way. That's how we have been informed through these kind of meetings whenever they are there, but we also deliver them to the communities they are down. Yeah, and the communities are aware. So we also set meetings at community level, monthly meetings or quarterly, then regional level, you know, we have region, national, regional, then district council, and wards, villages, you know, like that. So they are informed as long as they are also part of the solution. Yes.
Okay, thank you so much, Rabia, and a round of applause, and we need to move to the next session.
Thank you so much.
All right. Yeah, so we're now moving to the next session where we're going to hear about how civil societies are also working with communities. We're going to hear from speakers from literally all around the world and hear from them what is the effort they're doing and also what are their expectations towards the high-level meeting. So for moderating this session, I want to introduce my colleague, Elle Agard. She's the Deputy Director of React Europe. She provides analysis and advocacy input for global, regional, and national policy debates on antibiotic resistance. She has experience in access to medicine, policy and advocacy, as well as political advising. Elle, the stage is yours.
Thank you, Andrea, and thank you again, everyone, for coming today. It's really to see that all the seats are filled up, and I'm hoping more people also join in as we continue to have this conversation today. So as Andrea said, this session will hear interventions from a broad group of both civil society actors and communities, and try to provide you with a bit of a flavor of the various roles and the different roles that civil society has in the global response to AMR. And to kick us off, I would like to introduce my wonderful colleague from React Africa, Ms. Tracy Muraya, onto the stage. Tracy is the Deputy Director for Policy and Strategy at React Africa. She monitors policy developments to provide strategic guidance and engages with stakeholders to support health systems strengthening in LMICs in Africa. And they focus on antibiotic resistance in sub-Saharan Africa, React Africa. So Tracy? No? Come up here. You get to stand here. And I hand over. There you go.
So, good evening, everyone. I'm Tracy Muraya, and very short, I'm not sure whether you can see me. Should I? Then you can be able to actually know who you're conversing with. So my name is Tracy Muraya once again, React Africa, and pleasure to be here. Is what you see right there in front of you, to just take you through a little bit, 4 minutes of what we do. I'm not sure. But as React Africa, of the larger React, sorry? Did you tell me to raise my voice? Okay. Of the large, we stand for catalyzing action in Sub-Saharan Africa for the AMR response, right? Bottom line. And this we are able to, while also being cognizant of the strategically govern the larger React network, right? I'm sure you'll hear from some of our colleagues. But how do we do this? We're cognizant of the fact that, look, even if we advocate and lobby to our policymakers, whether it's at national, regional, local, subnational level, that all this then also needs to be translated and implemented by the people on ground, as we call them in Kenya. That means then we have to loop in a number of communities and community representatives. So we start right from the little ones. Our children in primary schools, I think you can see them right there. This concept was brought by our Latin America colleagues in React Latin America, where they successfully implemented a child-to-child methodology to engage young children in elementary schools to actually employ agents of change in creating awareness around AMR. While Latin America is quite impactful in terms of how AMR associates with the larger environment and the microbials around the world, if I may put it that way. We have seen that the best way then to go around this is actually to bring to the attention of our children the main issues that are there. They understand clean water, they understand sanitation, they understand nutrition, because these are the realities on ground where we are. Relate that to controlling infections and hence appropriate use of antimicrobials. Then we come up to our tertiary school level, or rather tertiary level students at the university level, where my colleague Julian actually takes them, is the one who leads that program. And they're quite innovative. They're able to bring about skits. They're able to, in fact, as of recently, put together an AMR youth-driven policy that has been taken and is supposed to address the high-level meeting as well, to show
in more than 30 projects is 20 countries, antimicrobial stewardship in more than 47 countries. So that is only the face of the provider, the doctor, right? But also, we have projects on training, the capacity builder. And in that sense, we have invested in education through the MSF Academy. And today we have more than 240 healthcare workers graduated in different programs on antimicrobial stewardship and IPC training. It's a program that is a constant coaching next to the student. This is why it's not broader. It's really intensive work. Then we have the face of the advocate. And I'm sorry the slide didn't come through fine, but that is MSF, our MSF liaison to the UN not long ago. So the thing is, we have advocacy at the local level, at the national level, at the regional level, at the global level. But to build that, we require the legitimacy that only the communities and the patients can give us. So we need to have proximity to people. And that proximity gives us the privilege to understand and document the access barriers to care. Because to me, and I think I spoke before, when you speak about AMR from the medical perspective, it's a problem of access barriers to quality care. So as long as there is a breach, there is a gap in any of the barriers that patients need to go through to access care, there is a possibility for AMR. From geographic access barriers, financial access barriers, stockouts and shortages, and many others that are highly related to the development. This is is my time or and so one more thing, we have the role of the watchdog, right? And we have the capacity as civil society to bring accountability, to ask for it. And in that sense, I would like just to mention the beautiful initiatives we have together with communities. We work with the people, surveilling stockouts and surveilling shortages of medicines. So if you don't find the medicines in your pharmacy, report it to this WhatsApp. And if you scale up that, like we did in our Stop Stockouts project in South Africa, or like we did the JAMS project in Mozambique, like we are doing now with the observatoires in Guinea, this is very powerful because people feel they have the power to say, I don't have my medicines. And then what we do doesn't stop there. We go for an analysis. What is broken in the change of supply? Is it the national level, the local, or is the pharmacist? And most of the times, it happens with little things, you know? A bad cardex, a bad register, drugs expiring. So all of this we have the capacity to do. And finally, yes, we have the privilege to be with communities who can contribute to close the knowledge gap, a knowledge gap that is still massive when we speak about vulnerable populations and AMR. So just let me close by saying today in MSF, and I'm just transmitting what we hear from our teams in the field, we have two populations that are of high concern for us in terms of AMR. The ones that are living in places affected by conflict, places in where you have open, dirty wounds, contaminated wounds, and patients do not have access to care. And I will invite you later to see the pictures we contributed with, but these are very painful treatments. And I think surgeons and others can tell us about how difficult it is to treat one of these injuries. Patients need to go to painful and long treatments, many times having to have amputations and others. So this is the face of AMR we see in Gaza, in Mosul, and that we see in Afghanistan and other places. So it's important to keep them also in mind when we speak about resistance. And the other face is that what people like to call the invisible. Places where there is not capacity for surveillance and diagnosis. Places where antimicrobial resistance is something we don't even talk about. That's of high concern. So there is a high need for implementing surveillance and diagnostics. So thank you for letting me transmit these messages, and thanks to all the colleagues. I think we are creating finally a nice community, civil society on AMR that is very much needed.
Thank you so much, Angela. Next up, we will hear from a slightly different type of organization. like to invite Ana Maria from the Brazilian consumers organization IDEC up here to explain a little bit about their work. Ana Maria is a nutritionist, and she holds a master in public health policies, and she works as public health specialist at the Institute for Consumers Defense in Brazil, which is also a partner of the REACT Latin American network. So over to you, Ana Maria.
Thank you, Hallie. Thank you for the presentation, and thank you for the great event. So good afternoon, everyone. It's a great pleasure to be here as part of the civil society mobilized around the threat that AMR poses to our collective sustainable development and well-being. I think, as other colleagues have said, AMR is a growing global health crisis that disproportionately affects marginalized populations. Brazil, as a country, is struggling to reduce inequalities, and a key player in the global supply chain of animal-based food production must advance in a strategy to overcome barriers to quality health care, strengthen the public health system, and promote the rational use of medicines in animal production. With this in mind, IDEC has participated in the Brazilian National Committee on the Rational Use of Medicines and is an active member of the Antimicrobial Resistance Coalition. We also invest efforts in advocacy strategies to mobilize leaders, public resources, and raise consumers' awareness to mitigate the impact of AMR on human, animal, and planetary health. It's important to mention that this year, IDEC and REACT Latin America approved a policy brief to a G20 engagement group. In the document, we reinforce that expanding dialogue between countries, civil society, communities, academia, and different sectors of government on this matter is essential. In addition to monitoring and improving existing national and international actions on AMR. Maintaining political commitment and allocating financial resources for the implementation of impactful approach will be essential to ensure the effective fulfillment of commitments on AMR. We expect the high-level meeting to make progress on countries' commitments to financing for developing countries and clear proposals to combat AMR and the establishment of mechanisms to ensure meaningful, inclusive, and transparent civil society participation in AMR governance and accountability. We also expect countries to promote human and animal welfare. Thank you.
Thank you, Ana Maria. And so very swiftly, we will move to our next speaker. I'd like to invite Julia Bishop up. Julia Bishop is the Director of Global Engagement at the AMR Policy Accelerator at the Global Strategy Lab. Julia focuses on policy research and building partnerships in AMR, particularly in low and middle-income countries. And she has a background in international and human rights law. Welcome, Julia.
Thanks so much, Helle. I have a different vertical challenge than Tracy. I'm a little bit taller than the podium, so I'll stand here. Thank you all so much for making the time to come today and to REACT and other colleagues for putting this on this evening. I'm really pleased to be part of a very female-forward panel to discuss this, this really, really important issue. And as Helle mentioned in her introduction, I come from the AMR Policy Accelerator based at the Global Strategy Lab in Toronto, Canada. And we are also a little bit of a different organization, similar to you, Anna. We were based at a research institute, and so our approach is really about championing evidence-informed policy. So we're not so involved in the on-the-ground work as many of my colleagues here, but we really are looking at ways in which evidence-informed policy can be enhanced and complemented by the experience and expertise of civil society and community members. I think sometimes of communities as being other than us, but we're all members of a community and we all have a role to play in this. And to that end, there's sort of three key things that I was reflecting on in preparing for this evening. The first is on the role that we all play around accountability. And I think when we look at the political declaration, there's no legal enforcement mechanism. And so we need to be the ones to hold governments accountable. That can be a partnership and it can be collaborative, but we really do have a responsibility to use all of our skills, all of our knowledge, to really be the ones to hold governments to account to the promises that they're going to make in a few days in New York. And I think something that civil society can do better than most is translate that knowledge and translate that understanding of what the commitments are into meaningful action. And something that the AMR Policy Accelerator is really promoting is the idea of having unifying goals behind AMR. It's been very successful when you look at HIV, when you look at climate change, and we don't have something like that for AMR. And I think it's something that's really needed to galvanize political action and also to be something that the public can engage with. We have a big communication problem when it comes to AMR, and this is something that we really need to work on as civil society, and I think it's a place where we can play a really significant role. The second piece where I think that we as civil society and we at the AMR Policy Accelerator are really trying to improve the ability of policymakers to have access to the evidence that's out there in a timely way and in a way that's communicated to people who don't necessarily come from an AMR background. There's many of us in this room who may be epidemiologists or veterinarians. I come from a legal background. I don't come from an AMR background per se. And so it's really important that we're able to translate that information, that knowledge, into things that are publicly palatable and that politicians can stand behind and really make use of. And then lastly is the idea of capacity building when it comes to policymaking and AMR. We're actually going to be hosting a pilot inaugural course on AMR and policymaking next month, and it's something that we hope to do again. But I think often policymaking is a bit of a nebulous concept. And even policymakers themselves, they might be coming from these technical skills, they're now in a policy position, and they don't necessarily know all the levers that exist when it comes to policy. So how can we help to build that capacity and work together to make sure that both policymakers and civil society are speaking to each other, that the evidence is available, and that we can all have a role to play in acting on AMR now, as the call says. And I was also thinking that how it would be fantastic if next time we come to high-level meeting, we're not talking about World Antimicrobial Awareness Week, but World Antimicrobial Action Week. Because I think that's really what we're all here to do, is let's move this forward. We've talked a lot, we've talked enough. The time is now, let's act, and let's act together. Thanks very much.
Thank you, Julia. So I think by this point you're probably realizing that we're showcasing the different roles of civil society, but not just the different roles. Now we're also going into different areas, not just looking at human health, animal health. And my next speaker that will come up here is Ms. Gabriela Kepa-Ak, who is a representative from WardRaid. Gabriela Kepa-Ak is a medical microbiologist and a general pathologist working at the Port Moresby General Hospital in Papua New Guinea. She is the chair of the IPC committee there and has collaborated with partners and co-facilitated workshops addressing antimicrobial stewardship, IPC, and diagnostics microbiology. Gabriela, the floor is yours.
Good afternoon, everyone. In Papua New Guinea, a Pacific Island nation where I come from, the most common admissions to all our hospitals are infectious diseases. And as I speak, 50% of all Staphylococcus aureus that are isolated in my hospital are actually resistant to flucloxacillin. And about 42% of all gram-negative organisms that are isolated in my hospital are actually resistant to ceftriaxone. This is my reality at Port Moresby General Hospital, the only tertiary referral hospital in a country of 12 million people. Almost every patient that is admitted to the intensive care unit has a hospital-acquired infection. Due to the challenges that we face establishing effective infection prevention and control measures. My name is Gabriela Ak. I'm a medical microbiologist representing WaterAid and Port Moresby General Hospital, who have partnered together with other stakeholders to address infection prevention control issues in my hospital. This partnership has been ongoing for the past 3 years, and the changes are remarkable. Port Moresby General Hospital is a 1,200 bed capacity hospital and average yearly admissions are up to 24,000. I chair the IPC committee in the hospital. Now, during the past years, our way to approach partners, we have changed that. When someone wants to engage with us at the hospital, we tell them, we want your objectives to align to our work plan at the facility level. And most of our partners, like WaterAid through their WASH programs, Combat AMR, Fleming Fund, they've actually done that. So they have their objectives, but we make our stand and we say, look, you have to align to our objectives. So we have seen a lot of outcomes, and one of the main things that we've seen is actually on our part, ownership. And ownership has a lot to do with sustainability, and we've seen that. With ownership, in my hospital, we've actually built the first in-house alcohol-based NRAB facility. So right now, as I speak, we are producing our own alcohol-based NRAB, so the availability is there, and it's been for 2 years, and I must say that hand hygiene practices have improved remarkably with that. Our collaboration with WaterAid through their WASH program has been at the grassroots level. The WASH team visiting our facilities wards, but going to the kitchens, as well as antenatal and postnatal wards. These are things that really need to happen if we want to address AMR at the root, community level and facility level. There is a critical need for investment by government and donors for WASH in healthcare facilities, because the changes that I've seen are real. We are talking about antimicrobial stewardship, we are talking about diagnostics. IPC, I feel, is not getting the kind of attention that it needs to get, because IPC is to do with prevention. Everything else is curative. IPC is prevention. And when you look at IPC, IPC is what gets going when everything is established. When your stewardship is running, when your lab is all done and working. IPC is what actually the patient, as well as the treating doctor, plus the facility, everyone is involved. And I feel that WASH has a lot to do with that, not just in the facilities, but all the way down to the grassroots level, at the community level as well. Having said that, I have 1 minute left. AMR is a neglected child where I come from, in the Pacific region and the country as well. With assistance from our partners, we are gaining some momentum. But we desperately need to accelerate that momentum to confidently keep a lead on the silent pandemic in the Pacific region, the islands of 1,000 tribes and languages. In resource-strapped regions like mine, funds are put into high burden, high demand of care required by people who are infected by multi-resistant organisms, while other pillars of combating AMR are neglected. The Pacific region needs to move away from a curative mindset to a more preventative approach at the community level. Multi-resistant organisms used to be a hospital issue a few years back in my country. But I must say now that infections from the community are increasingly becoming resistant as well. And the communities need to be more engaged and more aware of this health security threat. At this stage of the journey in the fight against AMR, I make a plea to all governments to meaningfully engage community-level healthcare and water users, healthcare workers, and civil society organizations like WaterAid, which work very closely with people in communities that lack these basic services as part of the global response to AMR. Let's flip the coin. It's the same coin. Let's do a bottom-up approach. Now that we have policies, guidelines, roadmaps, national action plans, global action plans, all these high-level documents in place, let's engage and empower our communities to materialize the high-level objectives by translating recommendations to financing. Thank you.
Thank you, Gabriela. So our final person to speak in person, that is Ms. Sunita Narain. Sunita Narain is an environmentalist and serves as the Director General of the Center for Science and Environment in India. And she's also the editor of the fortnightly magazine, Down to Earth. Sunita is a member of the One Health Global Leaders Group on Antimicrobial Resistance, and I would like to invite you up here, give you the floor.
You. And I'm so happy to be with you, and thank you, REACT, for organizing this. We're happy to be partners in this effort. So I'm an environmentalist, and my role and our role at CSE, the Center for Science and Environment, has really been to expand and to bring in the issue of food producing animals, agriculture, as well as the environment into AMR. And I have to say, it's been quite a journey. As a member of the IACG, it was tough to even get the word growth promoting antibiotics into the text. We could not even get the word into the text. And we couldn't get the issue of prevention into the text. We couldn't get the issue of intensive food farming systems into the text. It's been a journey. At CSC, our position has been threefold. One, we have a conservation agenda. The conservation agenda is really about protecting the antibiotics that are used for humans, critically important for humans, that should not be used in animal and in agriculture. And that's the agenda that we have been pushing both at the GLG as a member, as well as in all the work that we do. We then have, most importantly, the prevention agenda. And the prevention agenda for us is very critical because in countries of LMIC, we cannot afford the methodologies that have been used by the rest of the world, which is first pollute and then clean up. Okay, we just cannot afford it. So for us, the prevention agenda becomes very, very important. We cannot afford to first contaminate our water systems and then put very expensive technologies to clean out what are very, very difficult chemicals to get out of the water system. We cannot afford to have intensive food farming systems and then have systems in which we have retention systems so that we don't use the animal till the time the antibiotic hasn't got out of the system, forgetting that the bug is already in the system. It's in the water, it's in the soil, and we cannot afford to clean it up. So for us, the agenda is prevention. And that's really what our focus has been. And the focus for that has really been to also link with the systems of food farming. And that's a difficult discussion because even now, and you will have noticed that one of the targets that we pushed for very much in the draft was finally dropped. And you can well understand why it was dropped. It wasn't dropped because of industry from our part of the world. Be very clear about it. It was dropped because the intensive industrial food farming system does not want curbs on it. And that's the real fact of the matter. So they do not want controls and a target that says that you will have to reduce the amount of antibiotics used in the food system of the world. It's not because of countries of LMIC. It is because of the industrial farming lobby. And that is a battle we have lost right now, but I hope that in our world, we will be very clear that we cannot afford this industrial farming system in which we first pollute and then clean up. There are good stories. Some of the work that is happening in India, for instance, where the dairy industry has been able to bring down the use of antibiotics just through efforts of prevention and the use of therapeutic medicines, largely from traditional medicine sources. So I was very interested when the question on traditional medicine was asked because, I mean, these are homemade recipes, brought down the cost to farmers. The key issue was to make sure that your housekeeping improved so that the animals didn't get infected first and then have to clean up. So the prevention agenda becomes very clear. The prevention agenda is also the water agenda. And it was very nice to talk about that, because that's really the key for us. We can't afford to first pollute water, have disease, have the highest cholera levels, highest diseases that we are seeing today, waterborne diseases, and then give the antibiotics. So prevention is key. And it's good to see that prevention has come into the discussion of AMR. And I think that is a win that we all have. That is the civil society contribution, most importantly, to the AMR discussion, because that really changes the actions that we push governments to take. They become much more affordable, much more tangible, much more in their hands, and it isn't only about a chemical-based economy in which you go from one chemical dependency to another. And the last agenda that we have is, of course, the environmental waste agenda, where CSC has done a report on the pharma industry waste in India. We've been looking at how we can work with industries so that we can reduce, again, the need for very expensive pollution control equipment. Because the affordability agenda is also very clear for access. We need access as much as to stop the misuse of antibiotics. So the access and the misuse agenda has to go together. And for that, affordability is critical. So that's really in some of the work that we have been doing, and my colleagues in Delhi continue to do. And I do believe that this agenda, whatever happens at ANGA, which is very important because it shines a light on the urgency of the silent pandemic and the need to act. But I think for us, in our part of the world, the agenda is really about making sure that this gets integrated into our food systems, into our development systems, to make sure that we can prevent. Thank you.
Thank you so much, Sunita, for that very passionate intervention. So our next speaker recorded message on the screen, because unfortunately visa problems came in the way with very short turnaround time. Just wait a second before we started. Turnaround time for people, a lot of participants that wanted to join this week, the high-level meeting on AMR, were not able to actually get here in time and get their visa processed in time. So now come to the stage to come back up again while he's speaking, and then we will have time for a couple of questions from the audience before we close this segment. So we will now turn to Mario, who is a medical doctor and a public health specialist from Benin, focusing on health equity. He leads Musuhum NGO's public health interventions, as well as the CSO and network cluster of the AMR multi-stakeholder partnership platform. So please press play for Mario's intervention.
Hello everyone, I'm Dr. Mario. I'm the Secretary General of Museum, a West African organization where we work on major public health issues in the region with a particular attention on AMR. I'm happy to have participated in crafting this call to action from people to leader. This global initiative is so important for us in ensuring our communities truly take the leadership of their own health issues, health condition, and also that their voices are being heard regionally and globally by those who decide for them. And in this today's side event, this is precisely what I want to address. How do we ensure the representatives of those communities are present in the global dialogue like this one? You know, as the lead of the civil societies and network cluster on the quadripartite MSPP, I've received so many complaints from my colleagues, representatives of various global South organizations, civil societies organizations. To date, we are less than 10 days to the event in New York, and they still have not secured their letter of approvals, their flight tickets and other travel-related details. You know what that means? That means that many of us will not be able to attend this event. And we know that key decisions will be made during this gathering and with long-lasting impacts. And we know that Global South face the heaviest burdens when it comes to AMR's consequences. So I would like us together today to reflect on how do we ensure that those voices are being taken into account, how to ensure that policies and strategies that will be formulated in this event will be complete and comprehensive and won't be hard and difficult for us, field actors, to translate them into action in the field. That's what I want us to reflect on together today. I'm happy to see that Tracy is already there physically. I saw her name where we were preparing this side event with Andrea, and a special thank to Andrea that, in short, since the beginning of the year, we've been working on this call to action, that he always ensure that all from all the around the world are being taken into account. So I'm happy to be with you guys, and I look forward to.
And we will open up the floor to see if there are questions for our participants here. There's already a few hands up, so maybe you can pass over the microphone and we can get the conversation started.
Hello everyone. Alex Moherez. I come from the Africa Christian Health Associations platform, a network that looks at amplifying the voice of the faith sector in increasing access to healthcare in sub-Saharan Africa. I'm curious to know from the distinguished panelists, in terms of the level of evidence that we are using from the community to build community leaders and to make sure they champion this great challenge, what level of evidence do we gather to present to both the local leaders, to the national level leaders, or even at the global level? Thank you.
Anyone that wants to jump on that one? Can start?
It's Anita who pointed, but thank you. Providing evidence that's coming from the community is not an easy task, because it really is reliant on how have you broken down that scientific information, as Julia said, to make sure that the communities understand, to make sure that the faith leaders understand, to make sure different, including healthcare workers, as was said, for IPC, understand specific, were actually able to come up with what they're calling as a community engagement indicator framework to see. Okay, when we go on ground and we implement in the different ways that we know how to, information actually being digested by the stakeholders that we are targeting. And really that's the only way you can measure whether it's been broken down enough and digested. So case in point, for instance, I spoke of the little ones at React Africa, and maybe I'm a bit passionate about them because I've been in that program since 2019, I think. At first, of course, they had no idea what we're talking about, but as we go on, then they come to you and they are the ones proposing, how about we actually bring this out in the form of art? And then we have an exhibition like this one. When there was COVID, where the little ones were actually drawing and showing what they understand between disease and antimicrobial use and the environment, and when mom is actually using the same water to wash clothes where the cow is feeding, and we will eat that cow tomorrow, etc. So really, it's the nuances when it comes to the community, at least from my experience. When it comes to the faith leaders in Africa, our political us, when they are campaigning, so if our election is in 2025, 2024 will be a hotbed for campaigns. So then you're able to, with the literacy that has been passed on to the faith leaders, then they're also, oh my gosh. Yeah, so our, maybe, anyway, where was I? So the people online, but it's the nuances when it comes to communities. But I also want my fellow colleagues to talk about their experience.
Okay.
Sorry about that. Did you?
Tracy. Is it working now? Yeah, okay.
Tracy, yeah.
No, just to add to what Tracy said, I think it also comes back to the question of what is evidence and what constitutes evidence. And I think that we often have this very narrow view of what evidence is, and it has to be published in a peer-reviewed journal, and there's this very high threshold for what constitutes evidence in the sense of what is taken as such at a global level. And I think we also need to challenge that a little bit and think about how we can be more inclusive in what we consider to be evidence, because I think a lot of the solutions exist at the local level. And if we set this incredibly high standard, we're never going to hear those. We're never going to hear those solutions and those ideas. And so I think we need to rethink that. And it's a question that we've been thinking about in the context of the independent scientific panel that's part of the political declaration. And the need for that panel to be designed in a way that puts prevention and access, which Sunita was touching on, and equity at the forefront. This can't be a group of just Global North researchers who are leading this. It needs to be very inclusive. It needs to be LMIC-led, and we need to be sure that it produces a global public good that can be accessed by everyone and useful for everyone.
Anyone else that wants to chip in? Otherwise, we'll see if there are other questions. See, we have one more. We have time for one more question. Maybe we'll take that first. Okay. Masika? Maybe this one works better.
Thank you. My name is Masika Sophia. I work for the World Federation for Animals based in the US. I wanted to put the organizers on blast when it comes to animal health issues, but until Sunita spoke very passionately about what has been going on the political declaration, I reserved that for another time because we've had a lot of human health and very little on animal health. Most of the time we use the word One Health as a greenwashing term, and when it comes to the implementation on the ground, it doesn't happen as it should have. But now we have a political declaration that is very strong on the human health side, but very wishy-washy on the animal health side. And this is a document that is meant to guide member states in the work on AMR for the next 4 years until the next high-level meeting. Now, like you said, Sunita, it was very difficult to get in the word prevention, the word agri-food systems, and animal health, animal welfare with very strong commitments. But how do we go forward from your perspective? Because at the end of the day, we recognize that the issue requires truly a One Health approach where even the animal health sector is very much integrated on the same level, maybe even higher than the human health sector, because there's a very big drive of AMR from this sector. How do we guide member states to ensure that they, yes, I mean, they look at the political declaration, but how do we also guide them further to strengthen the agri-food system aspect of the political declaration and make sure that by 2029 we are still not talking about the same thing? Because if we don't do anything from the agri-food system sector, we still will end up probably worse than we are right now.
Excellent question. And so I have to say I am very disappointed that the final draft dropped some of the very strong statements on animal health and the targets. As GLG, we had, if you look at the final document that came out of GLG, which was aimed for UNGA, you will see that the animal health section is quite strong. And there are clear targets for both the use of, or the ban of the use of critically important antimicrobials in animal health sector, plus a target for reduction. So I think it is a missed opportunity. But I also understand that the pressures of the industry are very, very big. I mean, when you look at the human health sector is not so much a pressure coming from industry. It is really coming from an ability to be able to enforce and to be able to educate people on the wise use of antibiotics. But when it comes to the animal health sector, it is really an industry-driven agenda. And that has really meant an issue, and you have seen the fallout now. I think the answer really is for us to work with our governments and to be able to connect the agendas. I mean, see, I'm an environmentalist, so I'm sort of quite different from, I mean, we at CSE have sort of jumped into your community, and thank you for welcoming us and allowing us to be part of your community. But for us, the agenda really is the agenda of climate change, biodiversity, and AMR, and it links together. And it links together with the agenda of the food system reform that is needed. Because the food system reform is really about both, if you take climate change, the biggest challenge today, one of the biggest challenges is the food systems. And the industrial food system and the emissions that it produces. If you take the issue of health, then it's about the agenda of non-communicable diseases and obesity, and the fact that food system today is not delivering on the nutrition challenge. If you take the biodiversity issue, it's really connected to the issue of a lack of species, a lack of food that is grown in the world, which is diverse, which is built on soil, which is strong. All that connects to the AMR agenda, because the AMR agenda is really about a food system which is not designed for sustainability today, which is not designed for farmer livelihood or for affordability. So I think for us at CSC, definitely these three agendas come together. And I do believe this is something that we have to keep pushing, advocating for, because it is too important for our world. We cannot afford to let the food producing sector, and you know this, that in the US, the quantum of antibiotics used in the food sector are much higher than even the human sector. So we just have to deal with this. And I see these things coming together and for us to work together. Thank you.
Thank you. So that takes us to the very end now of this segment. I would like to just let you all know that these people will of course be here in the mingle afterwards, so any remaining questions might be there. I see that there were some hands that we didn't get to, or of course a possibility to go up and ask afterwards. But thank you so much for your interventions. Thank you so much for listening, and this is the end of this segment.
Thank you so much to all the speakers. Thanks, Helle, for moderating an excellent session. Now we're moving to the next one, and here we're going to discuss more about the call for action. You might have seen a few copies. We're also going to discuss about the origin of the call for action, how everything started and how... Is this working? Yes. So the next speaker that is going to discuss about how the call for action started and the project about the empowered communities, Natalie Elomeri. She's a seasoned public health epidemiologist with an international background in infectious diseases and surveillance, research and program evaluation. She joined the Pan American Health Organization in 2013, offering technical expertise, evidence-based decision-making on immunization, and currently supports AMR advocacy and policy. Besides, she has been leading efforts alongside REACT Latin America to improve community engagement on AMR in the region under the initiative Communities Empowered to Tackle AMR. Natalie, stage is yours.
Thank you, Andrea. Good afternoon, friends, colleagues, guests. It's such a privilege and a joy to be here with you today to witness how far we've come with this people to leaders. I'll be telling you about how this call for action came to be. Building on the first declaration from communities in Latin America and the Caribbean who took a firm stand against antimicrobial resistance within the broader context of our community engagement on AMR that we called Empowered Communities to Tackle AMR in Latin America and the Caribbean. So this journey began in 2020, seeing the alarming increase in drug-resistant infections across the region that resulted from the pandemic. We recognized that there was an urgent need to have a much more proactive approach to raising awareness about the impact of AMR, but also to talk about the actions that everyone can take to reduce it. And most importantly, we realized the untapped potential that lies within communities to prevent infections at the source and promote a more responsible use for antibiotics. So it became quickly clear that we needed to engage communities in a more sustainable way in the AMR response throughout our region, across sectors, and in a multidisciplinary way. We all know that when faced with external challenges, communities typically find ways to adapt, yet they continue to operate and function according to their own value system, practices, community structures, beliefs, etc. We've talked about this so far. So it was very important to promote at least the co-design, if not ideally, that interventions for AMR be led by the community, leveraging the local insights and knowledge that the communities have about their own environment, challenges, and resources. But now, how do we put AMR on the agenda of our communities? How do we make this topic, such a complicated topic, relevant for everyone? When we initiated discussions with REACT Latin America back in 2020, our strategy was to start by identifying and proposing common themes that would resonate across communities in our region. And so Tracy has touched on this a little bit. What were the topics that we included? For example, food and nutrition. A lot had been talked about the importance of nutrition, for instance, to build immunity against infections during the pandemic, for instance. Another key topic is water. Water is the pillar of community life. We've talked about this already. It's so easy to engage around water, whether to grow food, to prepare food safely. Also talk about water contamination, and also preserving the environment and living in harmony with nature. That is a fundamental value to many of our indigenous communities across the region. Another topic that emerged as a rallying point very quickly is children's wellness. So that became like a favorite topic of our regional events within empowered communities. We also we also use arts as tools for engagement. That's very important. Music, dance, and storytelling, which is deeply rooted cultural elements for anchoring messages and fostering meaningful connections. Also very early on, we try to identify not only champions, very often individuals that have that double skill of scientific background and artistic skills, but also communities that are already united and organized, so already empowered in a way around another cause that could easily become a champion for AMR. So what is Empowered Communities? It actually provides this platform for dialogue between civil society, communities, governments, international organizations, to converge community knowledge and scientific evidence, also share learnings, good practices, really fun and new ways to raise awareness and talk about different interventions at the local level on AMR. But it also advocates for the inclusion of civil society and communities in the design, implementation, and evaluation of AMR policies. So during the official launch of Empowered Communities, we drafted a declaration about the role of communities in the AMR response that subsequently was signed across the region by organizations and individuals with help from academic networks and partners. And this was served as the basis for the global call for action that we're here to talk about today. And Andrea will go into the details of that in a moment. So this initiative is a testament to the power of collaboration. I want to say thank you to all those who have contributed towards empowered communities in our region. And I want to end with, in the spirit of our initiative, in the words of Eduardo Galeano, famous Uruguayan writer, many little people in little places doing little things can change the world. Thank you.
Really excellent intervention, and thank you so much, Natalie, for being here today, for all the help that you and Pau have been giving from the very beginning. Here, I just want to show you how it looks like now, the call for action, and as I mentioned before, you have a copy in the back, so I'm not going to go into through. I know we all want to go to the buffet, so I'll be as quick as I can, but still highlights a few points here. The call contains requests for states and their key stakeholders worldwide. The focus it's indeed on vulnerable population, equity, and One Health by several of you already. Also, we are proudly saying that the code is available in 6 different languages: English, Spanish, French, Portuguese, Arabic, and Indonesian. So that was supposed to be the map, but I guess you can see the numbers. It might be even better, because otherwise you would be biased by the beautiful colors of the map. But let's keep it to the numbers, since I'm a scientist. So thank you so much to all of you. Yeah, it was increased. Over 185 civil societies from over 85 countries. So this is excellent. What I wanted to show you actually in the map was the diversity of all the different stakeholders, but I hope that you got a flavor of it by just listening to the people that have been speaking today and the several that for sure are following us from home. But the next point is actually a video I'm going to show you. So perhaps soon we can play the video, which is indeed about support. So we've been asking different supporters around the world that couldn't be in this room why they've been supporting the coalition. So we can hear directly through the video. Press play, please.
Es tiempo para que la humanidad pueda comprender que tenemos algo más que la disyuntiva de ir a la guerra o rendirnos ante las bacterias. Tenemos, en último término, que aprender a danzar con ellas. Se trata de una danza compleja en la que nos mantenemos a una respetuosa distancia, pero que nunca cesa, porque no podemos vivir el uno sin el otro.
short amount of time, this was excellent. Yeah, now I want to move on to the next session, which is, I think, one of the key sessions also of this, yes, there we go, of this event, which is indeed the handover ceremony. So we wanted during this moment to make sure that our call for action was indeed brought from the communities, from the people, as our logo says, to leaders. So I would like to invite back to the stage Rabia, that spoke at the very beginning. And I also would like to invite Miss Carla Galea, representing the permanent mission of Malta to the United Nations. Please reach this.
So thank you so much, Andrea. So all here is to hand over the call for actions and the signatures, like what we, the numbers, plus a list of individuals or of the people who were able to register to attend this event, plus the gifts that represents the call for action. So we have this necklace. This was crafted by a co-designer in Ikelala, where one of the lead team is based. It signifies community empowerment, uniting to protect antibiotics, and urging leaders to take immediate action against the antimicrobial resistance. It also symbolizes, the global solidarity and advocacy. This is it. Besides that, we have got the bamboo rainmaker. It was created by indigenous hands from the forest to the jungle of Asia. It symbolizes the harmony between humans and the nature. Its soothing sound evokes the lane and life circles, reminding us of our deep connection to the earth. And this is the call for action. Thank you so much.
Thank you so much. I'm speaking here on behalf of my ambassador, Ambassador Vanessa Fraser, who was one of the co-facilitators of the AMR process at UN, which you are all very well versed with, and I thank you all for following it so closely. Thank you so much for this event. It has by far been one of the best events that I've attended, and I'm doing high-level week as well, so you can imagine. Maybe I'm a little bit biased because I've been working on antimicrobial resistance very intensely for the past 1 year. So Thank you so much for all your work and for collecting all the signatures and for all these requests to member states and key stakeholders. And I can assure you that we fully align with each and every request in the text. What can I say? I think we've come a very long way since the 2016 AMR political declaration. The current political declaration that we have required a lot of efforts. I know that many wanted greater ambition in the text, but I still think that we've really come a long way. We've come a long way from a time when some delegations did not even want to call this AMR a threat. Some did not want to use the term One Health. So there are many intricacies that were involved. So I can also see a major shift in the way that AMR has been tackled. And this is all also thanks to you, thanks to all the stakeholders, thanks to the survivors, thanks to all the attendees at the multi-stakeholder hearing that we had in May of this year. And yeah, thank you to all the work. Civil society was an integral part of our process and of drafting the AMR political declaration. And we hope that what is included will form a solid basis for even greater ambition for the years to come before the next high-level meeting on AMR in 2029. Well, I hope to see you, or many of you, on Thursday for the adoption of the AMR political declaration. And really, thank you so much. It's been so inspiring and so humbling as well. Thank you.
Thanks to you, and I'll give you all the gifts later, so I'm not keeping it for myself. So, reaching the end here, and I don't think we could have ended in a better way than listening to our founder director of REACT back in 2005, Professor Emeritus Dr. Otto Kars, which is currently senior advisor, specialist in infectious diseases and antimicrobial resistance. He led Sweden's program against antimicrobial resistance trauma, co-founded REACT, and has served as an expert for WHO and other international agencies. It's truly an honor to have Otto here, and I think we need to give credit to all the work that Otto has been doing over the years, and has been one of the best pioneers that in this field. So a big round of applause, and I'll leave the floor to you.
Thank you so much. I know I stand between you and food and drinks, so I'll try to be short. But I was given the task to make some concluding remarks. This is what happens when you come to my age. And it's not an unpleasant task, though, really, because you can reflect on and give some perspectives back what has happened. But you can also congratulate and applaud what is going on and how many more people now are engaged, like we have heard today, in this issue. Compared to 2016, this is amazing, mind-blowing, really. So much has happened, and I didn't really realize it myself. Now, what we see here is a number of engaged people. What you feel in the room is passion, frustration, power, will, but also hope. And I would say one summary point could be that my dreams have come true. Why? Because when we started REACT in 2005, there were some people in this room. We had a network of networks. We were very early on this issue, as many of you know. But we invited many networks, from HIV networks, malaria, from the south primarily. And some people thought, let's create a grassroots movement on AMR. Well, we didn't. It was too early. The science wasn't really there. We had to push for science, push for data, push the WHO and the other organizations forward, and try to translate science to policy and make it understandable. Now we are here. I think this is the time. Just have a look at the numbers. So thank you very much. And I think we make a short break here and express our gratitude to all the speakers to be here, and your unwavering commitment to address this issue, your engagement and your engaging talks. So an applause to all. But, I mean, your stories here reminds us that we're not talking about a global health crisis, whatever. We're really talking about deeply personal things. Behind every statistics lies a name, a face, and a life that has been affected or even lost. But also, what you shared here today is a lot of knowledge, amazing knowledge, details, ideas. Those must be communicated and shared. I think this new movement that has been building now need to survive and must grow, and could be that point that we can have that knowledge sharing duty, and because this is important. I think another thing is that today's discussion has highlighted the one essential truth: AMR cannot be tackled isolated by isolated efforts or in silos, for sure. And a national action plan cannot stay as a governmental plan. It's not. It's a country's plan. Everyone must be engaged. And it requires unified, inclusive response that brings together all parts of the society. That is a very, very cost-effective way for governments to include professional organizations, civil society organizations, people in the work to help implement the plan, but also, for sure, making governments accountable for their commitments. So I think this has been a missing piece in the puzzle. It needs to happen. And the voices we have heard today reaffirm that communities are not just stakeholders in this response, but are essential partners. And a strong bottom-up civil society response is a well-known prerequisite for the success of other global health issues, as we know. The power is with the people. So, like Sunita, I was also in the Interagency Coordination Group, the UN Interagency Coordination Group, for some years, and we delivered our recommendations already in 2019. Yeah. Were they implemented? No. A few, but not all. COVID came in between. That could have been an excuse, for sure. It was a shock to the community. But never mind. Don't look back. We look forward instead. But yeah, look back. I would like to state a few things in that in the recommendations from the IACG. Among them was a call, this is the way to go, meaning civil society groups and organizations as key stakeholders in the One Health response to AMR. And provision of political, financial, and technical support for civil society organizations to enhance their engagement. Yes, it's time for governments to deliver on those things. Then we can go. So I see this as the start of a very important and completely unique movement that is given birth to. As we now move towards the political declaration adoption on Thursday, our collective call for global action stands as a testament for our shared will. And it's a call that emphasizes the urgent need for meaningful political commitments, sustained funding and policies to prioritize community involvement and equity in every global response. As you know, the numbers, it's amazing. And it could still grow. It's powerful. It will. I think many of us may be a bit disappointed on the outcome of the political declaration in some respects. Absolutely, it could have been better. But still, we must see this as a turning point, and mark a turning point in a shift from pledges to tangible progress, from discussions to decisive actions, and holding leaders accountable for their commitments. So, I'm sure now, more than I were when I came here, that we really can leave this room with a renewed sense of purpose and determination. We have a case, and we will make a difference to secure equitable and affordable access to effective antibiotics for everyone in need. So thank you, all the speakers again, REACT team and all the other organizers, and every other one that has taken part in this vital conversation. Let's continue this journey from people to leaders. I think this is just the beginning. Thank you very much.
Thank you so much, Otto. And yeah, we reached the end of our event, a little bit late, but yeah, it was important discussion, so we really wanted to hear everything from everyone. So I just encourage you to go around the room and see all the different exhibitors and exhibitions, from people to leaders, our posters here, Beckman's College of Design, Dance with Bacteria, which will be projected here, and there will be our colleagues, Sarah and Silvana will explain to you what is the concept of dancing with bacteria. MSF, the AMR narrative, Antibiotic Smart Sweden, WaterAid, and the video of ITN also will be projected on a computer. So thank you so much everyone for being here today. Wish you a great continuation, a great week. So much. And yes, drinks and food, it's up the stairs or on the ramp.
Es tiempo para que la humanidad pueda comprender que tenemos algo más que la disyuntiva de ir a la guerra o rendirnos ante las bacterias. Tenemos, en último término, que aprender a danzar con ellas. Se trata de una danza compleja en la que nos mantenemos a una respetuosa distancia, pero que nunca cesa, porque no podemos vivir el uno sin el otro. ¡Oh!
Sin temor